I want to quickly have you explain to our listeners the best way to find the right doctor, because I do know you hear all these horror stories about
Yeah,
people that go to Russia or Mexico or wherever because of the price.
right.
And, you usually get what you pay for. So I want people to really know, what you would think is the best way to find the right doctor, what questions you should be asking, or how you should be looking one up, besides looking at your Instagram and going to you, of course.
Sure. Yeah, no, I think that's a great question because there are a lot of great doctors out there. And there's, we tend to poo-poo a lot of these doctors who actually happen to be very good in Mexico or the Dominican Republic or South America, but sometimes you just don't know what you're getting, especially when these prices are so low. You could be getting this, person who hasn't been doing it very long, but they just have the lowest prices. What I would say is my preference and what I tell people is when you look for someone, you want to make sure that you kind of delve into one, their practice website, and then start looking into their social media. Look at what they're doing, see if they're sharing their surgeries on social media, and look at what they're doing. Also, if you're looking to do, and I'll say rhinoplasty or nose job because I don't do that, but you want to go to someone who does rhinoplasties every single day, right?
Right.
You don't want to come to me for a rhinoplasty, but you want to come to me for a breast augmentation or a breast revision or a breast lift because that's what I do every single day.
Yeah.
And so, as you know, that you get really good at what you do when you put in those 10,000 hours of doing the same thing over and over and over. So
Mhm.
I keep my practice to doing like four things, right? Breast, tummy tucks, liposuction, and body contouring after massive weight loss. That's all I do.
Mhm.
And because I have 4 or 5 procedures that I do over and over every single day, we get very good and very efficient. And so you want to make sure this person isn't doing like hand surgery one day, pinning the ears back on a kid on one day, breast, to me, that's someone who's a jack of all trades, but the master of none.
Mm.
And so you want to make sure they're board certified in what they're doing, that they have the proper credentials, and just make sure that they have one, you look at their Instagram results, you look at that, but you have to be careful with that because sometimes I know people who don't share or tend to take other people's pictures and say that they're theirs. And so you're
Right.
not getting a true gist of what they're doing. So you hopefully build a practice that you get word of mouth. But if you're
Yeah.
out there just checking it out, the first thing I would do is don't look at the other countries. Look around you. There's always someone around you who will be good. And the reason why that's the best is because they're close by. You have surgery with them, or if you have a complication, you can just drive to their office within an hour. But if you have surgery in the Dominican Republic, fly back. How are you going to get back there? You might send some pictures, but you'll only end up in the ER because no plastic surgeon is going to take a complication for someone outside the country. So it can be
That's a
very
really good point.
expensive.
Yeah.
So even if you have a pretty good result from the Dominican Republic, if you're not happy about something, what are you going to do? Do you have to fly back there and pay another $1,000 round trip, hotel, and figure out what's going on? So I think in the end, you end up doing better with someone who's relatively close in your region, who's
Mhm.
board certified, who has what appears to be good before and after pictures that are real. But I also think it's good that they have stuff on social media that shows them as a person talking about these surgeries, because that's the person you're going to meet. That's the person you want to be doing your surgeries, right? You don't want to see this person's picture, and when you show up, it's their assistant telling you, okay, this is what we're going to do. We'll see you about an hour. I don't think that's fair to the patient either.
Right. Okay. That's really good advice. Um, all right. I wanted to ask you, especially during COVID, you saw a lot of people that started this concierge business of coming to your house, doing your fillers. You started to see a lot of people as a side hustle, getting certified, or I don't
Right.
even know if they're certified,
No.
getting some sort of training. Maybe they've had enough done to their own face that they feel like they know how to do it.
Right.
But there is a rise and a boom of people doing this as a side hustle. What are your thoughts on the potentials of the dangers in that? And should you be going to a real med spa for what you want to get done?
So every state's different because one state might you just need some medical assistant who has a certification, whereas one state requires it to be a physician assistant. Another state might say, no, that's not enough. You need a nurse practitioner. So sometimes you really have to have some real credentials, and hopefully these people are showing them and can provide those for you. So it's just not some person who bought Botox from Alibaba in, China and just showing up to your house, right? Because they learned how to do it because they're the medical assistant and med spa, but they kind of want to do some stuff on the side. So I think looking at the credentials of the people, I think if there's a nurse practitioner who's doing that and they certainly have their credentials and they want to come and do that, I think that's certainly okay. I think there might be a little element to sterility. You typically are in a med spa in an environment that's a lot more controlled. Um, you don't need a huge amount of sterility, but what if you go into a house and there's a bunch of cats and dogs and that sort of thing? You're doing these injections, but cat hair and dog hair all over the place. I'd feel a little bit, bad that we're not getting, the place really clean for them to be. So I think it's okay as long as they have the credentials, but I don't see them really continuing to persist after COVID. I think people are still wanting to go to the med spa because there's a lot of collateral things you can do, right?
Mm,
If you get Botox, you might want to get your facial, which requires a machine, or you might want to get your hair removal. So a lot of things you're kind of doing together. And so I think people just like the idea of going there so they can look at the other services, and they're probably doing other services too.
right.
So I just haven't seen it a lot here in the Dallas area, to tell you the truth, as much as we saw in COVID.
Okay, good.